Hey everybody, it's Dr. Warren Kalkstein here at Kalkstein Chiropractic, your Baltimore area chiropractor. Today I'm with student Dr. Nicholas Kuhl. First time I've introduced Nicholas to our audience that follows us on YouTube and Instagram. Nicholas, you are Tri-9, correct?
Correct, yeah.
All right, got that right. You have 6 more months left of chiropractic school, per se, right?
Yep.
And we've got Nick working here in the office. He just started, and he's going to be joining me on these videos. We're going to be talking about dry needling and the different conditions that we treat with dry needling, okay? We throw a lot of different videos out there with different problems and people coming in and saying they've got this and that. I want to do an orderly approach to the different conditions that we get to help out in our office here in Baltimore. So we're going to start with the neck region, and we're going to show you how we treat different conditions that stem or originate from the neck area, okay? The very first thing that we're going to be doing today is something called, it's a big fancy name, cervicobrachial syndrome, okay? Sometimes it gets clumped in with facet syndrome or a pinched nerve in the neck, okay? So there's an area of irritation occurring in the neck, right? Usually it occurs just on one side of the neck. It accompanies itself with some burning sensation, sometimes into the shoulder blade area on the top. Sometimes, Nick, if you 180 for me, sometimes that burning sensation could come between the shoulder blade here. It's a pretty common area for it to occur. And sometimes if it's irritated enough, it's severe enough, it can be associated with pain that travels down the back of the arm or the front of the arm. Numbness and tingling in the hand can occur with this problem as well. So if that sounds like something that maybe you've experienced in the past, it kind of can come and go. This is something that we're really great at treating in our office, and dry needling is a very effective way of managing that pain, the tension that occurs with that type of a problem, and driving good blood flow, good healing potential into that area with the needle. So without any, so welcome to Baltimore.
Yeah, it's good to be here.
You've got a rock climbing membership started today, don't you?
I do.
He's gonna
anxious to get out there and climb. So
right on. We've got him kind of situated here. He's starting and focusing mostly on rehab. If you're a student intern out there, or if you're a student getting ready to go into your intern process, we offer an 8-month rotation through Logan University, which is one of the chiropractic schools that we work closely with. And we just started that with Antoine, you might recognize on some of our videos, who's doing a phenomenal job. And hopefully he gets to come in here and demonstrate some of his skills that he's picked up along the way. So let's get started. Nick, you're slightly nervous.
Just a bit, yeah. No, not a big fan of needles.
Not a huge fan of needles, so I'm going to show you as best I can. And Nick, you're going to have to pop that shirt off for me. I'm going to show you as best I can how I can be comfortable with the dry needling experience. So with patients that come in, and with Nick already, we've done an exam with him. We've had the right findings for this type of a problem. The pain associated with this area might be palpable when I touch it as well. And the range of motion will show certain deficits or restrictions when he's moving. And then the sensory symptoms that are associated with this. We'll do a neuro exam when he first comes in to see us. When I work the neck area, I palpate gently, and I want to clean the area of the trap in most cases. The rhomboid area here, the cervical spine, erector spinae group, and some of those deep stabilizing muscles that occur here. And then if it refers down, if he's got trigger points or tender areas along the arm, then I'll clean that area as well. For Nick today, we're just going to focus on working this area. I'm going to try to kind of be as minimal as possible in my approach with Nick for a couple of reasons, right? This problem that occurs is extremely painful and uncomfortable, right? I want to try to make this experience relaxing for him so his muscles don't tighten up. It's not too much of an input from the needles, so he can relax, and potentially even what patients say, they fall asleep when they get dry needling done in this manner. There's a lot of approaches when it comes to dry needling. Our approach here is to treat the areas of musculoskeletal pain and their referred trigger points and let those areas settle and relax, okay? How is that different than, say, someone that gets treated in a different type of office where the needle's getting stimulated and moved? That is a form of trigger point dry needling that some practitioners utilize. So I want to palpate for the tender taut bands. I want to feel for any tender areas or trigger points in the trap muscle. I I'm going to gently come into the rhomboid to see if there's any areas of tension, and Nick can kind of talk about when he's got a taut band, if it's a little bit more tender, you can almost flick the muscle if it's deep enough, and as well as you can trigger that trigger point, if you will. You can elicit a twitch response. A common question that we get, and if you have any questions as I go through that I don't address, feel free to throw them down in the comment section. I'm happy to get back to these, and I'm going to be responding to your questions about my approach with each one of these problems. Say that you have this, maybe you have a couple questions about it, right? When I treat this problem, I also make sure that I'm going to go to the neck area last. I'm going to wait to work that area because sometimes it can be a little bit more tender. Nick.
Yeah.
You did it.
First needle down.
First one down. There's a couple things that you can do when needling in this area to make sure that the patient is calm and relaxed. And the reason that I'm kind of going through this is, one, so that you can see a gentle approach for treating this type of pain, that you don't have to be afraid of getting treated this way. But also for Nick's ears as well, because he's going to be doing this soon. He's going to be going and treating people in this way. He's currently finishing up some coursework at Logan, and then he's going to follow up with some more coursework here in the Maryland area. So the first area that I worked on was the trap muscle. Now I'm going to some of those tender spots around the rectus spinae and the thoracic spine, just where the cervical junction comes down. He's got a little tension in this area. You're 5 in. Are you good?
Mm-hmm.
Great. The levator scap muscle kind of splits between this corner of the shoulder blade and the trap muscle here, and the rhomboids over here. A lot of times people talk about nagging, burning pain at the corner of the scapula. They talk about how they try to smash it or roll it out, and sometimes that can be beneficial. I like this method of treatment because it gets right to the source of the irritation and delivers a mechanical stimulus that's deep inside the muscle. Depending on where the irritation is occurring, it can affect any number of muscles along the course of the nerve. These muscles of the shoulder blade that sit here and here, that sit here, the tricep muscle, the deltoids, any of those muscles can have painful burning sensations. A lot of times it can stem from the neck. No pressure. If I can, I try to give the patient a little bit of warning. If I feel like I'm in an area that might be a little bit more of a surprise for them in terms of the intensity, right? So I'll let them know, yeah, you might find some tenderness in this area. You might find a little bit of a reflex in this area. You might feel a little muscle twitch as well.
Yep.
Do you feel that in that rhomboid there?
Yeah, definitely.
Guess what muscle gets worked a lot for Nick?
Yeah, that's a good one.
Is that muscle right there, that rhomboid minor that sits right above there. He reaches, holds, pulls his shoulder blade into a position to leverage his body up a wall. He's a rock climber. He's going to work those tissues. You might find just some myofascial muscle irritation, myalgia, muscle pain, muscle spasms in that area just due to his sport as well. You're a pro. You're doing just fine with this. So Nick is going to be a part of our series as long as he's comfortable working these areas and learning about how to treat these tissues. And I think that's really going to be beneficial for Nick because he's going to learn some of the verbiage that I use with patients as I'm working on them. But more importantly, you can learn a lot, especially going through chiropractic school, through getting work done, through touch. You can feel how I'm using a lot of pressures in different areas when I go to set the needle. If you find, like, you remember when you took some of those courses at Logan with other students?
Yep.
It's a little tender there, huh?
A little bit.
Yeah. Did you feel like it was a lot of, or sharp pinches when you got pushed in?
With that last one?
No, just in general when you were at school. If a student's working on you, did you ever feel like it was a little bit more of a shock or a surprise?
I'm engaging for sure.
Yeah. My point being that there's some things that you can do around an area to relax the tissue so that the insertion of the needle isn't as much of a surprise. And here is that spot where I'm getting a lot of tension. Like I was talking about before, I want to save the worst for last, if you will. So around that level in the neck, around that C4, C5 level, where he's got more hypertonic tissue, he's got more of a twitch response to the tissue, easy. And I have to be a little bit more patient with the insertion.
For those, it's more just like a pressure than a sharpness.
So a lot of patients breathe and exhale easy. We'll talk about that pressure over really areas of a lot of tension. Doing well. So I'm going to work both sides of that level in the neck. That's easy, just right here. Good job. Breathe. So a lot of times as well, Nick's kind of naturally doing it. I apologize for not coaching you through this. Take breaths in and out before I go ahead and set these, okay? And I'll talk you through it a little bit more. Nick, right now, are you comfortable?
Yeah.
Good. So you'll see that the insertion or that timing where I am placing the needle or I'm working that space is one of the most uncomfortable times, if you will, for dry needling. But while he lies here, his body, in most cases, starts to relax. He gets comfortable. He's able to settle in to that sensation of the needles. So, relax. You're all set. You saw C4, C5 area get worked on. His erector spinae group around that level in the neck were needled. He was needled in that upper thoracic cervical junction because he just had a lot of tension built up there. I want to treat those areas of tension as I also work the nerve. We worked on his rhomboid muscle here. We did the insertion of his levator scap where you had a bundle of tension. And then I worked the trap muscle. Okay, we're set, we're relaxed. He's down for 10 minutes now. And then next, we're gonna bring him up after he relaxes, maybe falls asleep. He just gets comfortable in this position, and we're gonna put some form of heat on it, okay? And I like that a lot because it helps improve the effect of dry needling, okay? So you saw dry needling for a pinched nerve, maybe for the first time, or maybe you've seen a ton of videos and you're comparing them. If you have any questions about how we treat pinched nerves in the neck that cause a lot of neck pain, burning sensation into the shoulder here in Baltimore, please just comment below. I'm happy to reach out and answer as many of your questions as I can get to. And I really am grateful for the audience's support up to this point. We're on a really fun journey getting to 100,000 subscribers. So if you're with me now, thank you so much for your support and I appreciate you all. Thanks and have a great day. Thanks for watching.